Hey, wait, I got a new complaint. Hey guys, so today we're starting a new 3-part series about shin splints. What shin splints actually are, what causes them, how to treat them, and most importantly, how to prevent them. So today we're going to look at what exactly are shin splints. If you've ever had shin splints before, you know that there's a very intense pain along the inside part of your shin bone, running from the middle of your shin all the way down towards your ankles, sometimes a little bit higher, but typically right in that window. And it definitely hurts when you're running, but if somebody touches your shins when you're dealing with shin splints, you know it, because the pain is super intense and you're probably going to want to knock that person out. But on a more technical level, what shin splints actually are is the muscle that runs along the inside part of your shins, which is called your anterior tibialis muscle. It runs all the way down your shin bone and connects into your arch. And when you have shin splints, what's happening is that muscle along the inside part of your shins is actually tearing away from your shin bone. If you've ever had shin splints before, you know that dealing with the injury is definitely no fun, and you probably want to do anything you can to possibly avoid it. So what are some of the common causes of shin splints? When it comes down to it, the most common cause of shin splints is poor arch support. And that can come both in the form of poor shoes or poor arch support in the shoes that you're wearing, or it can also come from a lack of anatomical arch support, and it may not matter what shoes that you're wearing, you may still end up with shin splints. Another common cause of shin splints is transitioning from running on soft surfaces like a nice track or trails, running cross country, things like that, to doing a lot of repetitive running on hard surfaces like concrete, asphalt, and even some indoor tracks. Your arch acts like a big shock absorber when you're standing, walking, and of course when you're running. And if your muscles in your body and your arch aren't used to the extra stress and extra force of running on a much more hard-packed ground, like your concrete, your asphalt, and your indoor tracks, it may not hold up. And as your arch flattens out more and more and more and more from a repetitive stress standpoint, it puts more and more strain on that anterior tibialis muscle, and you end up with the micro tears along your shin bone that lead to the classic symptoms of shin splints. So if you're dealing with shin splints, or if you've dealt with them before, you know that it's definitely no fun. And make sure you tune in next week when we're going to look at how to take care of a shin splints injury and manage it so that it goes away, and then ultimately preventing it down the road. Hey, wait, I got a new complaint. Forever in debt to your priceless advice.